I invited a special guest to share a few words with the Washington Township staff family. As you know, we have had a wide range of special guests in the past at this program. But today, I am honored that our guest is not only a North Central graduate, not only a former Washington Township parent and a longtime supporter of Washington Township schools, but also has been directly on the front lines of this pandemic since early 2020. Dr. Profeta is an emergency room physician at St. Vincent Hospital and has been the closest of any profession I can think of to the complexities, constant change, and tragedies resulting from the pandemic. He has given countless support to patients and families of those impacted during this past year. In April 2020, Dr. Profeta personally supported the Logan family and saying goodbye to their beloved father and husband, Mr. Logan, during a time when family were not allowed in hospitals due to COVID-19. As many of you know, in December 2020, I myself was admitted to the St. Vincent Hospital due to COVID-19. In the midst of severe breathing difficulties, which impaired my ability to speak clearly and easily, in the midst of no family by my side to advocate on my behalf because the hospital was still closed to visitors, and in the midst of the uncertainties of simply being hospitalized with COVID-19, it was Dr. Profeta who showed up in my hospital room with his Darth Vader-like medical grade mask to check on me even when he was not on duty. He continued to check on me, sneak me snacks as I was improving, and gave me the real deal medical updates without filter, even though I was not on his caseload. After nearly a week in the hospital and on the day of my discharge in January, with still a very long road of medical recovery ahead, Dr. Profeta put what I deemed as 2020 being an awful year in perspective for me. He shared, if you are still here, 2020 was not such a bad year. Dr. Profeta, even though he has been on the front lines of the pandemic for over a year, has maintained an optimistic human approach, which is contagious. As we close out a challenging year, he was the first person who came to my mind as a guest speaker for today to share an optimistic message with Washington Township staff. Please help me give a warm Washington Township welcome to Dr. Profeta.
Thank you, Dr. Woodson, for that kind introduction. Life is what happens while you're busy making other plans. I've always loved that quote from John Lennon because no better truism sums up the totality of the human condition than that. In a lot of ways, it represents the very essence of emergency medicine, that sudden, often tragic transformation of life we in medicine know all too well. I mean, how often have we heard words like, just yesterday we were taking a walk or we were dancing, we had bought tickets, we were going to go to Florida. No doubt you had plans this year. You were going to travel. You were going to teach your classes about fruit flies and Pythagorean and Chaucer and Monet. Maybe at the breaks you were going to go visit your relatives, write that book, renovate that basement. You were going to go to your own kids' ball games, their recitals. You had tickets to Motley Crue and Guns N' Roses for one of their many last chance tours. Your team was going to go to the playoffs, right? I mean, this was your year. This was the year you were going to win it all. You had plans to spend those waning days with your own aging parents and grandparents at family dinners. One more Yuletide, quiet conversations and gentle laughs over black and white photos of days gone by. I get it. You had plans. I mean, we all did. And how easy it is to retreat into misery and outrage over perceptions of missed opportunities or the emotional posts of idiots and Google experts who sat in the back and they shouted that this could have been done better, that could have been done better, only we had done X, Y, and Z, because it's easier for some to blame others they disagree with or a system that they don't understand than to admit that we are oftentimes just blowing to the winds of Mother Nature and that science, it evolves, often in front of our faces, and sometimes we have no control over anything other than how we choose to respond in the face of tragedy. Be that with a clenched fist of outrage or an open hand of understanding. I mean, I'm blessed. I got to care for COVID-19 patients in a community where open minds and open hands far outnumbered furrowed fingers, where my inbox was filled with messages of encouragement and thanks on days that I wondered if today would be my last. Those early days of the pandemic where I made sure my wife knew my passwords and who to call and where to bury me and what to tell my sons, and that it would be okay to date again or even marry again should I fall ill and not come home. I worked in a township where piles of food was dropped off to our exhausted doctors and nurses, and handmade cards from school kids. They dotted our walls, and the sentiment of thanks echoed through every fabric of our lives, elevating us from months and months of depression. As masks dug into our face, leaving welts and rings across our cheeks and noses, as we Skyped in family members so they could watch their loved ones die. And while I never thought in my lifetime that I'd work under these conditions, I understand the nature of viral pandemics. All ER docs do. We all suspected that this could be a possibility. But I breathe easier these days. I'm truly confident that those days, as they pertain to COVID-19, are fading behind us. And as Abraham Lincoln would say while scanning the fields of Gettysburg, where so many Americans came to rest, we're a country that is experiencing a new birth of freedom, and it's for us, the living, to be dedicated here to the unfinished work. Well, that unfinished work, it starts with you. I mean, it's your turn now. We all know that virtual learning was a Band-Aid on a bullet wound. In a lot of ways, COVID-19 has forced us to look at education and medicine through a different lens from this point forward. I mean, that's the nature of change. And you're now tasked with that unfinished work of educating those who were left behind in this pandemic. And there are many. Their education over the last year and this coming year will have an impact on health and well-being for decades to come, and it will ripple through our emergency rooms in time. As Teddy Roosevelt once said, you do what you can with what you have where you are. You did just that. You should be applauded for what you were able to accomplish with what you had at the time and what your leadership's allowed you to do. But we all know it wasn't enough. Us in medicine know this reality all too well. The resources and knowledge that we had in the early days of this pandemic were simply not enough to save many of the lives that we can now confidently salvage. Science, education, our resources, our creativity, however, is fluid. It's ever-changing, and we are constantly learning. And this incredible transformation from death to light came about not only by way of the advancement of science and vaccines and therapeutics, but by way of crowdsourcing that knowledge, reaching out to countless other disciplines and asking for help that came not only from scientists, but engineers, computer programmers, social workers, chaplains, housekeeping, logistics, and product pipeline experts. The salvation of America from COVID-19 was not only the work of healthcare heroes, but of truckers and cooks and mechanics and factory workers and all of you in the community. Don't you know that? And guess what? The recovery of education is going to require the same concerted effort and willingness on your part as educators to be creative, to ask for help, to recruit this incredible community to come to your aid with supplies, sweat equity, tutoring, mentoring, study tables, and volunteering. You're going to find that there are thousands of us willing to give of our time and resources to help you out. We just need you to tell us what you need, and an understanding on your part that you are going to have a really tough time going at this alone, and that if you're open to it, we will be an arm of support during those times you feel overwhelmed, in those days where you think you may not make it. This coming school year will perhaps be one of the hardest of your career, but it will also be one of the most rewarding. The greatest impact you will ever have will probably find their roots in the fall. I know you didn't plan on it. I also know that each of you have a strength of character and inner determination and a commitment to the future of our children to enable you to rise to this challenge. And I also know that as a proud graduate at North Central, as a parent of children who once walked your hallowed halls, as a member of this community, that the open hands of my friends and neighbors from 96 to 38, from Township line to Graham Road, will lift you up when you're down, will catch you when you fall, and we will support you hand in hand in this noble endeavor toward healing. God bless you, my fellow educators. God bless you in this task.
Thank you, Dr. Profeta, for taking time to share these inspiring words with the Washington Township staff family. Additionally, we want to thank you, your team of doctors, nurses, and hospital support staff who have worked tirelessly for over a year to support the health and well-being of our community during a pandemic. Your words of wisdom around life is what happens to you while you're busy making other plans will remain in our hearts and our minds.